In this video, I'm going to teach you 3 simple things you can do to improve your thoracic mobility. So your thoracic spine is the chunk of spine in between your neck or your cervical spine and your lower back or your lumbar spine. Most people don't work on this, and especially as you age, that can become a problem. If you lose mobility in your thoracic spine, it's going to put more stress on your neck and your low back and be one of the causes of having a back injury, which is one of the #1 injuries that we see in physical therapy. So if we can get your thoracic spine to move more, you're going to have better mobility, less pain in your neck and your back. So first exercise we're going to do is a really simple thoracic extension exercise. So I have a foam roller here. You can use some towels or some pillows, but foam roller works really well. Pretty affordable thing to have around the house to work on your thoracic extension. So what you're going to do is you're going to lay down on this. You don't want this in your low back, so kind of where your belt line is, you don't want it there. You don't want it way up by your neck and your shoulders. You kind of want it somewhere in the middle of that, right in between your shoulder blades. So from here, I'm going to find a spot that I need to get some extension. So we get a lot of flexion in our thoracic spine because for the most part, we're spending a lot of time sitting in cars, at desks, that kind of thing. We don't spend a lot of time in thoracic extension. So what you're going to do, cross your hands over like this. You can bend your knees if it takes a little pressure off your low back. And all you're going to do is simply hinge over the foam roller. Hold for a couple seconds and then come back up. Only go through a tolerable range of motion. So if you've not done this before, it might be a little uncomfortable to get into extension because we spend so much time in flexion. Just kind of be careful with that. Get into extension, take a deep breath in, and then breathe out. And you can probably tell as I breathe out, I get a little bit more extension. So find 3 or 4 spots in the thoracic spine to get some extension. If you get better extension, it will equate to better rotation and better overall thoracic health. The next thing we're going to do is we call this in our clinic like thread the needle. So you're going to get onto your hands and knees, and from here take one hand, so I'll take my right hand, put it flat on the ground, and all I'm going to do is try to reach my hand as far over as I can go, and I should be feeling some pressure in my mid-back, a little bit in my shoulder, maybe a little bit in my low back too. But from here, I'm trying to reach over as far as I can go, and this is working on thoracic rotation. So this is important in our rotational athletes. If you need to kind of look over your shoulder when you're emerging in traffic, that's really important. So just kind of going over here and holding for 5 seconds, coming back, same thing the other way, rotating here, rotating over as far as you can go, holding for 5 seconds, doing 10 to 15 each side will help out with thoracic rotation. The last thing I'm going to show you is a simple chair exercise. Grab a pole, broomstick, PVC, whatever you got. Elbows on the chair. You can also do this on the side of your bed and just kind of bringing hands and the bar kind of up to your head or close to your forehead. And then from here, what you're going to do is you're going to sink your hips back and think about bringing your chest down to the ground. Now, obviously, your chest isn't going to get to the ground, but that's the motion that you're trying to go for. So we're kind of sinking hips back, and I'm thinking about sinking my chest down towards the ground, and I'm feeling a little bit of pressure right in the middle of my shoulder blades. That's where I should be feeling that. So holding that for 5 seconds, and then coming back up. So you should kind of see this is thoracic flexion, and then kind of coming down, thinking that I'm getting my chest down to the floor to get into some thoracic extension. Same thing with this self-mobilization, holding for 5 seconds, doing that 10 to 15 times. That will help get you some thoracic extension and help decrease the chances of you having a neck or a low back problem. So if you like this video and want some more content like this, just make sure you subscribe to our YouTube channel, like this video, and you can comment below to let us know how to get better information to you guys. So I hope you like that video, and I'll talk to you soon.